It's one of the oldest diseases known to man, with a history dating back thousands of years. Leprosy, also called Hansen's disease. On Tuesday, the Department of Public Health and Social Services reporting one confirmed case of locally acquired Hansen's disease. Public Health also confirming the TB Hansen's disease program are continuing case investigation and coordinating with healthcare providers to ensure early detection of possible cases. And despite common misconceptions, Chima Mbakwam, program manager for the Guam TB Hansen's disease control program, says it is curable and not easily spread from person to person.
95% of people who get exposed to it actually do not get infected. One thing is that leprosy cannot be transmitted through casual contact or insect bites, So one thing is that you just have to be in prolonged contact with somebody that has the disease. And another good thing is that it is very curable. So when there's early detection, when you don't have all those disabilities, if you're able to catch it early, treatment is easy and quick. And we have the medication here at the TB Hansen disease programs.
Hansen's disease is caused by slow-growing bacteria, Mycobacterium leprae and Mycobacterium lepromatosis, which can affect the nerves, skin, eyes, and the lining of the nose.
It's actually prolonged close contact with somebody who has untreated leprosy via respiratory droplets. So when someone who has untreated leprosy coughs or sneezes, then the bacteria leaves the body and then someone can inhale it and then get infected.
In some cases, the loss of sensation in affected areas can increase the risk of injury.
It is not a highly contagious, it's mildly infectious. But the challenge is that between the time of exposure and the time of symptoms showing takes a very long time. And because of that, a lot of people do not know that they have the disease. So that's why most times when you see people with the disease, it's almost at a stage where they would have big patches on their skin.
Symptoms can include discolored or light patches on the skin, painless ulcers on the soles of the feet, or enlarged nerves, often around the elbows, knees, and side of the neck. Mbakwam emphasizes early detection is crucial. Treatment, which is offered free at the island's TB Hansen's disease program, uses a combination of antibiotics. Once treatment begins, which usually lasts 6 months to 2 years, patients are no longer considered infectious.
The earlier you identify the disease, then the earlier you start treatment, then transmission is cut off and every other person is safe.
And while leprosy is curable, Mbakwam is calling on the community to remain vigilant, as an action plan to eliminate the disease is underway.
The director actually signed the leprosy elimination roadmap for Guam. And the good thing about it is that plan was actually made towards getting Guam to zero leprosy. So the plan is that at the end of 2030, Guam would have been free of leprosy. So now that we're seeing these locally acquired cases is because we are becoming more vigilant, making sure that we ensure that people get tested, they get adequate treatment. And with that in mind is for everybody to be rest assured that there's a plan. And that plan is for us to eliminate leprosy by 2030.
As for testing and diagnosis, Public Health notes, quote, a trained healthcare worker can diagnose leprosy through a clinical evaluation that looks at skin lesions, sensory loss, and thickened peripheral nerves. To confirm the diagnosis, laboratory tests such as a skin biopsy or a slit skin smear can be performed. For more information, visit KUAM.com.